The silent pill. Why simvastatin is so widely used but poorly understood. What if the little pill you take before bed is doing more or less than you think? Welcome to Health Integration. If you're passionate about understanding how medications truly work in your body, don't forget to subscribe, hit the like button, and turn on the notification bell so you never miss a video that could change your health journey. Every day, millions of people around the world take a small, quiet pill before bed, Simvastatin. It's one of the most prescribed medications globally. But here's the surprising part. Most people don't actually understand what it's doing inside their body. If you or someone you love is on Simvastatin, this video will open your eyes to what it really does, why it's prescribed, and what no one explains at the pharmacy counter. What is Simvastatin? Simvastatin is part of a group of medications called statins, which are designed to lower cholesterol levels in the blood, reduce the risk of heart attacks, strokes, and death from cardiovascular disease, slow the buildup of plaque inside arteries. In simple terms, it helps your body stop producing so much cholesterol, particularly LDL, the bad kind, while modestly raising HDL, the good kind. Why lowering cholesterol matters. High cholesterol is a silent threat. It doesn't hurt. It doesn't make you cough. It doesn't keep you up at night. But over time, it clogs your arteries and increases your risk of coronary artery disease, stroke, peripheral artery disease, heart failure, and most dangerously, it builds up slowly, without symptoms, until something catastrophic happens. Simvastatin works in the background, preventing that buildup from ever reaching a crisis point. Why is it so widely prescribed? Because it's been around for decades. Simvastatin is well-studied, generic, affordable, effective for a broad range of patients. Doctors often prescribe it after a heart attack or when a patient has multiple risk factors, even if cholesterol isn't dangerously high yet. For many, it's not just about numbers, it's about prevention. How Simvastatin works. Inside your body and why timing matters. You take the pill, you swallow it. But what actually happens next? To understand how Simvastatin protects your heart, we need to look at how your liver produces cholesterol and how this drug cleverly interferes with that process. Inside the liver, cholesterol production, 101. Your liver makes cholesterol using an enzyme called HMG-CoA reductase. This enzyme converts substances in your body into mevalonate, which is the raw material your liver uses to create cholesterol. Simvastatin works by blocking this enzyme. When the enzyme is blocked, less cholesterol is produced. LDL, bad cholesterol, levels start to fall. HDL, good cholesterol, may slightly increase. Triglyceride levels may improve too. This doesn't just change lab numbers, it helps slow or even reverse plaque buildup in your arteries. Why you should take it at night. Here's a detail many people overlook. Your liver produces the most cholesterol at night, especially between midnight and 3 a.m. That's why Simvastatin works best when taken in the evening, so it's in your system at the right time, when your liver is most active. Unlike some newer statins, like atorvastatin or rosuvastatin, Simvastatin has a shorter half-life. That means it doesn't stay in your bloodstream all day. Taking it in the morning could miss the peak cholesterol production window. Tip: set a daily reminder on your phone to take it after dinner or right before bed. What happens if you take it at the wrong time? It won't harm you, but it might not work as well. Studies show that taking Simvastatin at night improves its ability to lower LDL by a greater percentage, achieve cholesterol goals faster, reduce cardiovascular risk more efficiently. So if your doctor didn't mention timing, now you know what they might have missed. Summary: Simvastatin blocks cholesterol production in your liver. Your liver makes the most cholesterol while you sleep. Taking it at night maximizes its benefit. How long does it take to work? And when you'll see real results? You've started taking Simvastatin. You're committed. You're showing up every night with that little pill. But now you're asking, when will I actually see a change? The first effects. What happens in week 1? In the first few days, Simvastatin starts blocking cholesterol production in your liver. But here's the thing. Your blood cholesterol levels don't drop overnight. During the first week, what's really happening is your liver is producing less LDL. Your bloodstream is slowly clearing out the excess inflammation in your blood vessels begins to reduce, even before cholesterol falls. But you may not feel any different, because cholesterol doesn't cause symptoms. That's why tracking your numbers is key. When will my cholesterol actually go down? Most people start to see meaningful changes after about 4 to 6 weeks of consistent use. Typical reductions include LDL, bad, cholesterol, drops by 20 to 40%, total cholesterol, improves by 15 to 30%, triglycerides, reduced modestly, HDL, good, cholesterol, may go up 5 to 10%. The full impact usually stabilizes by 8 to 12 weeks. That's why doctors recommend repeating your cholesterol test after 6 to 8 weeks, not sooner. Before that, the results can be misleading. What about heart protection? This is where Simvastatin's real power lies. Studies show that the protective effects on your heart and arteries build up over time. After 6 months to 1 year of use, benefits include reduced arterial inflammation, slower plaque buildup, lower risk of heart attack and stroke, and the longer you take it consistently, the more protective it becomes. What slows down results? Several factors can interfere with how well and how fast Simvastatin works. Missing doses, taking it at the wrong time, morning instead of night, poor diet, high in saturated fats and sugar, not combining with exercise or weight loss, mixing it with certain medications or grapefruit juice. Yes, grapefruit juice can interfere with Simvastatin's metabolism and should be avoided. Expect cholesterol improvements after 4 to 6 weeks. Heart protection builds over months and years. Don't rely on how you feel. Check your labs, stay consistent, and results will come. What are the real risks? Side effects. You should, actually, worry about. If you've heard scary stories about statins, you're not alone. Some people refuse to take Simvastatin because they fear side effects more than the disease itself. But what's fact? What's fear? And what should you actually watch for? Let's separate real concerns from online rumors. The most common, and usually mild, side effects. Most people who take Simvastatin don't feel anything unusual. But during the first few weeks, some may experience headache, digestive issues like nausea, constipation, or gas, mild muscle soreness or fatigue, trouble sleeping or vivid dreams. These effects are usually short-lived and go away as your body adjusts. Tip: take your dose with food or right before sleep to minimize discomfort. When to be concerned about muscle pain. Muscle-related side effects are the most talked about and the most misunderstood. Statins can sometimes cause muscle aches, weakness, tenderness. But for most people, it's mild and manageable. However, in rare cases, statins can lead to a serious condition called rhabdomyolysis, where muscle fibers break down and affect the kidneys. Call your doctor if muscle pain is sudden, severe, or spreads. You feel extreme fatigue, dark urine, or fever. The pain continues even after stopping workouts or stretching. This side effect is rare, especially at lower doses like 10 to 20 milligrams, and more likely at 80 milligrams or higher, a dose most doctors now avoid. Liver enzymes and blood tests. Simvastatin can cause slight elevations in liver enzymes. That's why doctors may test your liver function before starting and again after a few months. The good news? Permanent liver damage is extremely rare, and routine testing is mostly a precaution. Avoiding alcohol excess and grapefruit juice helps reduce this risk even further. Who should be extra careful? You should tell your doctor if you have a history of liver disease, have kidney problems, take medications like antifungals, HIV antivirals, or macrolide antibiotics, are over 70 years old and starting Simvastatin for the first time. These factors don't mean you can't take the medication, but they require closer monitoring. Don't fear Simvastatin, but respect it. Side effects are real, but rare. And for most people, the benefits far outweigh the risks. Stay alert, communicate with your doctor, and don't make decisions based on rumors. The Simvastatin controversy: what critics say and what science actually shows. Simvastatin, like all statins, has faced a storm of criticism over the years. You've probably heard things like, statins are a scam. They don't work. It's all just big pharma propaganda. They're poisoning people. So, where's the truth? Let's break it down. Claim 1. Statins don't actually save lives. Some critics say statins only lower cholesterol, but don't make a real difference in heart disease outcomes. The truth? Major clinical trials like 4S, HPS, and JUPITER have consistently shown that statins reduce the risk of heart attacks and strokes. Statins reduce cardiovascular death. Even in people with normal cholesterol but high inflammation, statins help. Statins like Simvastatin don't just change numbers, they change outcomes. But they must be used consistently and alongside lifestyle changes. Claim 2. The side effects are too dangerous. Yes, statins have side effects, but the vast majority of people tolerate them well, and most complaints, like vague muscle pain or fatigue, aren't confirmed in blinded trials. In fact, studies show that up to 90% of reported side effects disappear when people don't know whether they're taking a statin or a placebo. That's the power of the nocebo effect, expecting harm and then feeling it. True side effects are real, but they're far less common than fear makes them seem. Claim 3. Statins deplete CoQ10. This one has some merit. Statins slightly reduce levels of coenzyme Q10, which helps with energy production in cells. This might contribute to muscle symptoms in sensitive individuals. However, the reduction is small. Most people don't notice any difference. CoQ10 supplements may help, but results are mixed. Still, it's not a reason to avoid statins entirely, just a factor to monitor with your doctor. Claim 4. Doctors push it because it's cheap and easy. It's true, Simvastatin is generic and inexpensive, but that's actually a benefit, not a flaw. Statins are one of the few medications that have decades of research behind them, are widely accessible, prevent disease rather than just treat symptoms. Yes, they're prescribed often, but not because of profit. It's because they work for millions of people at low cost. The controversy around statins is fueled by fear, frustration, and misinformation. But when you strip away the noise, the science is solid. Simvastatin saves lives, quietly, slowly, and consistently. Don't let online myths outweigh real-world benefits. What happens if you stop taking Simvastatin? The rebound effect. Few people expect. At some point, almost every patient asks, "Can I stop taking this now?" Whether it's because of side effects, lifestyle changes, or just frustration, many people stop Simvastatin on their own without telling their doctor. But here's what you need to know. What happens if you quit cold turkey? When you stop Simvastatin suddenly, your liver starts producing cholesterol again at full speed. Your LDL levels climb back up, sometimes higher than before. Inflammation in your arteries may return. Plaque buildup can accelerate again silently. You may feel nothing at first, but the risk is internal and long-term. How fast does cholesterol rise after stopping? Within just 2 to 4 weeks, your cholesterol can begin increasing noticeably. And if you had a previous heart attack, high blood pressure, diabetes, or a family history of heart disease, you're putting yourself back in the danger zone without realizing it. Stopping Simvastatin erases the progress you've made faster than you think. The dangerous misconception: I feel fine, so I don't need it. This is the biggest trap. High cholesterol is a silent threat. You don't feel it creeping back in, just like you didn't feel it when it first got high. Many people stop statins because they feel healthy. But health isn't about how you feel today. It's about what's happening inside. When can you actually consider stopping? You should only consider tapering off simvastatin if your cholesterol is consistently under control. You've made significant sustained lifestyle changes. Your doctor has done a full risk reassessment. You're on the lowest possible dose already. Even then, it's not an instant switch. Doctors usually recommend rechecking your lipid panel, reducing the dose gradually, monitoring for 2 to 3 months, reassessing cardiovascular risk. Never stop cold turkey. Always involve your doctor. Stopping simvastatin might feel like regaining control, but it can actually mean losing protection. If your body still needs support, don't take it away without a plan. Your future self depends on the decisions you make today. If your body still needs support, don't take it away without a plan. Your future self depends on the decisions you make today. Simvastatin versus other statins. What makes it different, and should you switch? Simvastatin isn't the only statin out there. In fact, there are several others your doctor might consider: atorvastatin, Lipitor, rosuvastatin, Crestor, pravastatin, lovastatin, fluvastatin, pitavastatin. So why did they choose simvastatin for you? Let's break it down. Potency and strength. Where simvastatin stands. Statins are ranked by how powerfully they lower LDL cholesterol. Simvastatin is considered a moderate-intensity statin. 10 to 20 milligrams daily lowers LDL by 20 to 30%. 40 milligrams lowers it by 30 to 40%. Compare that to atorvastatin 40 to 80 milligrams, lowers LDL by 50 to 60%. Rosuvastatin 20 to 40 milligrams, also 50 to 60%. So if you need aggressive LDL reduction, other statins may be stronger options. But for many people, moderate lowering is enough. And simvastatin fits the bill. Side effects. Simvastatin is gentler, usually. Simvastatin tends to be better tolerated at lower doses. Fewer reports of muscle pain, less impact on blood sugar, lower risk of liver enzyme spikes. That's why it's often the first statin doctors try, especially in older adults, people on multiple medications, those with borderline cholesterol. If someone doesn't tolerate simvastatin, a switch to pravastatin, even milder, may be considered. Cost and accessibility. Because simvastatin is generic and widely available, it's extremely affordable, covered by most insurance plans, easy to find in any pharmacy. Other statins like rosuvastatin or pitavastatin can be more expensive or restricted by insurance, so if simvastatin is working and tolerated, there's often no reason to switch. When switching might be right, you might consider changing statins if your LDL isn't dropping enough despite full doses. You've had persistent muscle symptoms, you've had a heart attack or high-risk event, and need stronger LDL reduction. You're combining it with other cholesterol-lowering meds, like ezetimibe or PCSK9 inhibitors. In these cases, a higher potency statin may be more appropriate. Simvastatin isn't weaker. It's just right-sized for the right person. It balances effectiveness, safety, and cost. But if your numbers or symptoms demand more or less, there are smart alternatives available. Can you take simvastatin for life? What long-term use really means? By now, you've probably accepted that simvastatin isn't a quick fix. It's a long-term strategy. But what happens when you're taking it not for weeks or months, but for decades? Let's look at what the science and real-life experience say about long-term statin use. Does simvastatin harm your body over time? One of the biggest fears patients have is, if I take this for 10 or 20 years, will it damage something else? Here's what we know. Simvastatin is not toxic to the liver or kidneys in healthy people. It does not increase cancer risk. It does not damage your heart muscle or brain. There is no evidence it shortens lifespan. In fact, it may extend it in high-risk individuals. For the majority of users, simvastatin remains safe even with decades of use. What about memory or cognition? Some online sources claim statins cause memory loss or foggy thinking, but large studies, including those from the FDA and the American Heart Association, have found no consistent link between simvastatin and dementia. Some cases of mild memory issues were temporary and reversible. Statins may even protect brain health by reducing strokes and vascular inflammation. That said, if you ever feel cognitively off, report it to your doctor. Everyone reacts differently. Will it weaken my muscles over time? This concern is valid, but mostly exaggerated. While statins can cause muscle aches in a small percentage of users, they do not destroy muscle tissue over time in healthy people. Long-term use at low to moderate doses, like 20 milligrams per day, 10 to 40 milligrams is generally well tolerated. Regular physical activity and QOQ10 supplements may help if needed. There's no proof that simvastatin leads to frailty or muscle loss with age. Do you ever graduate off statins? Yes, but rarely. Some people can stop taking statins if they make major lifestyle changes, achieve optimal lipid levels, reassess their cardiovascular risk as low, but for those with prior heart attack or stroke, diabetes, high blood pressure, or strong family history, simvastatin is often a lifelong partner, not a temporary prescription. Simvastatin isn't just a pill. It's a long-term shield. For millions, it quietly prevents tragedy year after year without making a sound. If you stay consistent, monitor your labs, and communicate with your doctor, you can use it safely for life. What you should ask your doctor. Before your next simvastatin refill, you've taken the pills, you've followed the instructions, you've committed to your health. But before you fill that next prescription for simvastatin, ask yourself, am I just following a routine? Or do I actually know where I stand? It's time to have a smarter, more informed conversation with your doctor, one that puts you back in control. Questions to ask at your next appointment. Here are the essential questions that could change everything. How are my cholesterol levels now? Are they where they should be, or do we need to adjust the dose? Is my risk of heart disease still high? Has anything changed in my health, weight, blood pressure, or habits? Do I still need simvastatin, or should we reevaluate? Not every patient needs it forever. Ask what your long-term plan looks like. Should I stay on this statin or try a different one? If you've had side effects, it may be time to explore options. What tests do I need to monitor safety? Blood work for liver enzymes, kidney function, and muscle markers might be due. What else can I do besides pills? Diet, exercise, supplements, sleep, and stress management are all part of the equation. Bring this info with you. Before your appointment, prepare a simple list with your current medications and doses, any side effects you've noticed, any changes in lifestyle, diet, weight, exercise, family history updates, if any relative had a new event, questions you don't want to forget. This makes the appointment faster, clearer, and more productive. What to listen for. If your doctor says, your numbers are perfect, let's lower your dose. We should check your liver function next month. Let's try a switch and see if you feel better. Keep doing what you're doing. It's working. That's great. But if your doctor never reevaluates, never asks how you feel, and just auto-refills your statin forever, it's time for a deeper conversation. The goal isn't just to take your meds. The goal is to know why, track your results, and adjust your plan when needed. You're not a passive patient. You're the driver. And simvastatin is just one tool on your journey. Ask questions. Stay curious. Protect your heart with confidence. If this video helped you, please share this information, subscribe and like to help our community grow. Thanks for watching. Bye-bye.